Well, in this week's Cardiology Countdown, we'll talk about bereavement, also weight training and the risk of diabetes, and new recommendations from the American Stroke Association, American Heart Association on the new anticoagulants for atrial fibrillation. So first up is an interesting study that looks at bereavement and its consequences on heart rate and arrhythmia potential. It's a study of 78 subjects who were spouses or parents going through bereavement, death in the family, and about 50 controls, where they found an increased heart rate in the 2-week period following the start of bereavement, as well as decreased heart rate variability. And so both of those could be potential links to cardiovascular events. And that it provides an intriguing mechanism of the increased risk of cardiovascular events for such patients and might lead to some therapeutic manipulations. Next up is a study that looks at the different types of exercise and the risk of diabetes. This is a study from the Health Professionals Follow-Up Study, so I guess we all somehow participated in this. 500,000 patient years of follow-up, 18 years of follow-up. That found that increasing aerobic exercise reduced the risk of diabetes. That's known. But interestingly, adding in weight training also reduced the risk of diabetes by about 1/3 if that were added in once or twice a week. And so that was independent of aerobic exercise, and I think a useful thing since I did weight training this morning in the gym. It feels good about that. The number one pick this week is a scientific statement from the American Stroke Association and the American Heart Association on the use of the new anticoagulants for prevention of stroke and atrial fibrillation. They list as Class 1 two of the three agents, dabigatran and apixaban, not yet FDA approved, and a Class 2A recommendation for rivaroxaban. All of them get level of evidence B, where there was one large trial in comparison to warfarin. They also note that apixaban gets a Class 1 recommendation as an alternative to aspirin in patients who are felt not to be suitable for vitamin K antagonism, and that's on the basis of the Averroes study. Finally, they make reference to the fact that the safety and efficacy in combination with antiplatelet therapy with any of these agents really has not been established and deserves further study. So for this week's Cardiology Countdown, I'm Chris Cannon.